My name is Sekhar, and I'm an associate professor of radiology at Emory University. Patients with chronic liver disease need to undergo routine surveillance. According to the AASLD guidelines, or the Society for Liver Disease, patients should undergo ultrasound screening every 6 months. If there is a lesion that is found that's greater than 2 centimeters or 3 centimeters, those patients need further evaluation with an MRI, or if they cannot get an MRI, a CT scan. Patients who are on the transplant list need to undergo more extensive surveillance, as the goal is to get them off the transplant list within less than a year. And those patients usually undergo MRI screening every 3 months. Screening will also depend on the severity of the liver disease. Patients who have very little fibrosis or findings of cirrhosis, an ultrasound may be sufficient for screening those patients. However, if there is extensive cirrhosis, an MRI would be strongly preferred. It's a more sensitive exam, but it's not usually used for screening since we have such a large population of patients with chronic liver disease. Just like with follow-up imaging, the decision between an MRI and a CT scan will be an individual one depending on patient factors. But the most important thing is that you have an MRI or CT scan that is done at a specialized enough center where they have protocols that are specific to detect liver disease and liver tumors such as hepatocellular carcinoma. This means that they have to have the timing of the contrast properly and do a multiphasic scan. And for MRI, there are additional sequences that we perform to look for tumor recurrence versus tumor necrosis.